Professional English in Use Medicine, Chapter 21, Gynecology. A. The female reproductive system, womb, fallopian tube, ovary, net of wombs or cervix, vagina. B. Menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known menarche, as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP. 2/52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 18 days. If a period lasts more than 4 and 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhagia. Often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman starts menstruating normally at about the age of 50. It's called the menopause. Menopause or climacteric. In every English, it is known as the charge of life, or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat and night sweats. C. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist, are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Light. Do you get clothed? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. The contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. Exercises. Exercise 21.1. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy. Surgical hysterectomy, surgical removal of the uterus, menorrhagia, prolonged menstrual period, salpingitis, fallopian tube infection, cervical biopsy of a small piece of tissue removed from the neck of the womb. 21.2. Read the conversation between the gynecologist and the patient in the opposite and complete the notes about the patient. Menarche, 12 years. Menstrual cycle. 4/28. LMP. 1/52 ago. Menorrhagia, no. This dysmenorrhea, no. Discharge, a little white discharge. 21.3. Now write the questions that the doctors asked. Look at the opposite to help you. Menarche. How old were you when you started to get them? Menstrual cycle. Are you period regular? How long do periods last? When was your last period? Menorrhagia. Would you say they are light or heavy? Do you get close? Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between the periods? What color is it? 21.4. Complete the case report. One word is needed twice. Look at B and see opposite to help you. 45-year-old woman have been having prolonged periods lasting for 8 days. With the passage closed for 9 months, there was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral concentric contraceptive pill until a year previously when a copper coil was fitted. She had had a normal pregnancy when she was 25. Chapter 22. The heart and circulation. 1. A. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases, it may be present even at rest. A patient who is breathless when lying flat or orthopnea, for example, in bed, will tend to rise on 2 or more pillows. The abbreviation SOBOE stands for shortness of breath on exercise or on exertion or on effort. Patient says, I get terribly short of breath, climbing stairs. Doctor can ask, how many pillows do you sleep on? B, heart rhythm. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 2,000 per minute. The heart rhythm may be regular or irregular. In an irregular rhythm arrhythmia, there may be early beats which interrupt the regular rhythm. Premature beats, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptom of palpitations. Case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, or topnia and palpitations. A mitral valve replacement have been carried out 3 years previously, and this has stabilized the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which have been particularly severe for the 6 months before admission. 3. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute. For the body's needs, it may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema or swelling, beginning in the feet and ankles. This is known as feeding edema. If when a finger is pushed into the fluid, it causes a small depression or pit. Exercises. Exercises. Exercise 22.1. Complete the conversation based on the case history in the opposite. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? How long have you had them? Patient, for about six months, but I have heart problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. 22.2. Make word combination using a word from each post. 2 words can be used right. Look at B and see opposite to help you. Address. Atrial fibrillation. Cardiac output. Heart failure. On effort. Feeding edema. Premature beats. 22.3. Try the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help you. Dyspnea, shortness of breath, arrhythmia, palpitations, orthopnea, breathlessness when lying flat, edema, swelling. 22.4. Complete Complete the case report, link at A, B, and C opposite to help you. A 60-year-old woman attended her GP surgery complaining of breathlessness on exertion. This has been increasing over the previous 8 months until it was producing problems at around uh, 500 meters. Walking on the level, there was no history of chest pain. She had had several episodes of fast palpitation, which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling in her ankles. By the end of the day, this disappeared overnight.